Hi, this is Dr. Jack Allergy. If you like the content that I provide, I would just ask you to click the like button. If you want to keep up with the videos that I put out, I would love to have you subscribe to my channel. And you always hear people talk about metrics, which I have no idea and I don't understand, but subscribing and liking is always appreciated. A friend pointed out to me that I have not ever published a video on food allergies, and I was shocked by that. Now, food allergy is a giant topic, a giant subject that has major ramifications and is very significant. But it's been years and I have never published a video, and that is something that I want to change. So this video is just going to be on the very basic concepts of food allergy. And then I'm going to produce a series of videos discussing specific food allergens, then even more specific information such as Oral Allergy Syndrome and Fruit-Latex Syndrome. So I'm really going to put out quite a few videos, and that way people can pick and choose what they if they want to just focus on peanut allergy or they want to look at tree nut allergy, they can just jump to that video. But today is just the basic concepts of food allergies. So what is an allergy? And I know I've said in past videos, this word is corrupted. An allergy is an IgE, as in epsilon or excellent, mediated reaction. Now, the immunoglobulins, especially IgE, is really a very relatively new or young discovery, as it was discovered in 1967 by a Japanese scientist. And you have to realize that in science, 50 years is really nothing. It is very young, and so it is a barely understood science. Now, something that comes up a lot, there is a huge difference between food allergies and food intolerances, okay? An allergy is an IgE-mediated and allergic reaction where IgE binds to a receptor on specific cells. That receptor is known as the Fc epsilon receptor, Fc epsilon R1, I believe, receptor, and it binds to that cell. Then the allergens, when you get exposed, cross-link, and then it causes the release from your allergy cells, which are eosinophils, dendritic cells, mast cells, basophils, neutrophils, you name it. And so that release is histamine plus many other allergic reactive substances. The difference is food intolerance. It is not an IgE-mediated reaction. It is not an allergy. This is a very important difference. Food intolerances, there are many, and just a few examples are lactose intolerance. Lactose intolerance is the loss of the lactase, L-A-C-T-A-S-E, enzyme, which is involved in breaking down lactose, which is in dairy, and people have reactions. Typically, they tend to be GI-related reactions, nausea, diarrhea, gas, all that stuff. That is not a food allergy. There is something known as tannin intolerance. Tannins are byproducts produced in such as aged cheeses, aged wines, and people can have reactions. The classic ones can be nausea, but headaches and migraines can be triggered with tannin intolerance. There's also something we all have heard about called celiac disease, gluten intolerance. This is not an allergy. There is gluten allergy, where you actually can do testing that looks for the IgE, or the allergic antibody, to gluten. But in celiac disease, this is an IgA-mediated disease where your body actually produces antibodies that attack the endomysial enzymes and the tissue transglutaminase enzymes in the gut that prevent you from breaking down gluten. It is an autoimmune disease We're learning more and more about it, but it is not an allergy to gluten. It is an intolerance that is autoimmune mediated, and people have significant GI-related side effects because they cannot break down these proteins. With the enzymes are gone. Okay, another important thing is the foods themselves. There are more common foods versus less common foods, aka everything else, all right? Now, when we think about the most common foods, these foods are responsible for 85 to 90% of all the allergens or all the reactions that occur with foods. It is peanuts, eggs. What part of the chicken does the egg come from? Something cool to look up. Here's a hint. Why does it come out yellow? Tree nuts, shellfish, soybean, milk, wheat, and fish. Those are responsible for 85%, 90% of food allergy. Now, there are some, we're learning more and more about it, and they might actually be considered part of this expansive but small list of foods. Would be corn, sesame, and then the rosacea family. Rosacea family typically are your strawberries, blackberries, raspberries, blueberries, the berry family that tend to cause more skin-related reactions. But it does happen with other foods, and I'm not saying it doesn't, but peanuts, eggs, tree nuts, shellfish, soy, milk, wheat, and fish are responsible. They are the most common allergens that trigger food reactions. Now, everybody's genetics are different, their body is different, so of course, it can happen with other foods. It is just a lot less common. Okay, I do plan to make multiple videos, a series of videos on these expansive but limited allergens, food allergens, so we can have you focus, and I can focus on that specific allergen, what to do, how it's treated, and so on and so forth. Now, something that I need to just point out in this basic concepts video is there are a lot of sham clinics and sham providers, aka doctors, mid-levels, doctors that claim that they're doctors, but they're not MDs, or they're MDs or that do not have certification or any sort of specific training in allergy, asthma, and immunology, which is the fellowship that one has to complete, something that I did, to get a true understanding of this. Now, the problem with sham clinics and sham providers is that they order these huge panels. And the only thing I can say about huge panels is that they are huge mistakes because there are a ton of false positives. So what happens is that you go to the sham provider, sham clinic, and they order these labs, and then you get this giant list of labs as long as your arm, and then you ask them, well, what does this mean? And they go, oh, I don't know. Go see Dr. Jack Allergy, or go see somebody who can explain it to you. And of course, many of these labs are not covered by insurance. They are not the correct labs. And so this is what really makes it very difficult, is that what's worse is that they will check IgG as in gamma or great or grandma to foods. Okay, now let's just do a very, very basic immunology lesson. So there are 5 immunoglobulins: G, A, M as in Mary, E as in epsilon, and D as in David. So G is in gamma, A is in alpha, M, as I said, Mary, E is in epsilon, D is in David. So IgE is the allergic antibody. That's the antibody that triggers allergies. None of these other G, A, M, or D trigger allergic reactions. IgG is the memory antibody. Okay, it is long-lived. It has a very strong response to infection, especially if you've been exposed before, but it is absolutely useless for food or allergy testing. Useless. What does it mean when you have memory and IgG responds? It means you have eaten this before. Therefore, it is absolutely useless. IgG does not trigger allergic responses. It doesn't. It has nothing to do with allergies. It does not even fit the Fc epsilon receptor. It might be able to bind to the food because that's the AB portion of the antibody, but the Fc portion has nothing to do, cannot bind, does not trigger allergic responses. It is a complete waste of money. If you go to the main websites for, it's called the Quad AI or the American College of Allergy, Asthma, and Immunology, you will see that one of the first things they talk about when it comes to food allergy testing is any sort of testing with IgG is a waste of money. It is also the reason that insurances don't cover it and you pay out of pocket for it because it has no utility and no use for food allergy testing. Okay? Another waste I want to talk about is ordering these huge panels. They are useless. You get tons of false positives. A false positive basically means that I do the test, it comes back positive, but it's false because you have a zero reaction. There's nothing. It means nothing. False negatives, as an example, is when something is falsely negative, but it really is positive, and that can be a significant thing. Now, with food allergy testing, the testing is sensitive, but it is not very specific. So sensitivity means it is good at ruling out. So if you're negative, the likelihood of you being negative is very high. But if it's positive, it doesn't mean that that's a problem or that's what's triggering the reaction. So good sensitivity, not great specificity. Sham providers send you to me to explain the results because they can't make heads or tails of it. All right? This is a problem. You're out a lot of money and you've just had labs ordered, IgG labs, that are a waste. So basically, some of the patients I get, and they'll even get, there are, providers will order even large panels of IgE epsilon food allergy panels. And so they get this giant panel back and then they send you to me. And what happens? Well, some of the classic examples, here's one of them. 45-year-old patient who comes in with this huge panel. And then they say, well, what does this mean? So I look at this giant panel and it shows that they're positive to chicken. So then I ask them, have you ever had a reaction to chicken? Nope, never had a reaction. Actually ate it last night for dinner. I love it. Okay, that's a false positive. You're not allergic. I get a lot for beef. And I go, okay, do you ever had a hamburger? You ever have this? Yep, have it, no problems. Okay, check mark, false positive. One that I don't love and patients don't love to hear, but I'll get it with eggs. So I ask them, okay, what happens when you eat eggs? And they will say, well, sometimes I get nauseous. So I go, oh, light bulb goes off. And I go, okay, tell me more. Because maybe egg is one of those allergens, and so maybe they have a problem. So I say, what happens if you eat one egg? And they say, nothing. 2 eggs? Nothing. 3 eggs? I might get a little nauseous. Okay. 4 eggs? Oh, I get nauseous. Okay. You're not allergic to eggs. Sorry. It's just, that's not the way it is. If you're allergic to eggs, you have problems very early on. You can't eat the full egg. You're going to have reactions to it. So what you're talking about there is that it's a quantity issue. It has nothing to do with quality of the allergen. That's a problem. So don't order these huge panels. Don't get huge panels. What we really want to do in the field of allergy is I want it to be problem focused, problem allergen. I'm going to ask you specifically what allergens, if you eat this, what happens with that? How long does it take? So it's a very large thing that happens. So problem focused, problem allergens. Don't go get huge panels. These are just some of the things that I deal with as an allergy expert where people have issues with certain things. So I am going to be making a series of food-specific allergens and discussing everything that we talked about at the beginning. If you like this video, I would ask you to give it a thumbs up. subscribe. You might actually get some interesting information, or at least something to laugh about or look up on your own, because I always feel that educated patients are the best patients. Listen, you need to be the strongest advocate for yourself. This is Dr. Jack Allergy. I hope that you had wonderful holidays, and I look forward to uploading more videos.